This is called test day, sort of a usual way to describe it, but many of you go through testing. And testing is important because it can give you answers, but you have to realize also what testing may not give you. We are still learning so much, and there's a patience as the medical team and also as the patient and your support people too, what testing can give you and not give you. So let's think about the fact that there was a time when people did not even know about really orthostatic disorders or POTS, for example, and people were just confused or bewildered about what was going on with people who had dropping blood pressure and racing heart rates and misdiagnosed, mislabeled, and maybe potentially just called this all anxiety or something else. So that then we called it orthostatic disorder or POTS. And it became something as opposed to being misdiagnosed as something else, often misdiagnosed as something that was not very good for a person because it led to a lot of medical error and medical bias. So that's a good example of testing. So we're still learning. And why that's important is many of you are in a place where you might still have symptoms and ongoing issues, and the tests come back normal. And it does not discount what you're going through, but you have to have context knowing what a test can give you and what a test cannot give you. Sometimes a test has limits and challenges. Example are like the ANA autoimmune test. 1 out of 4, 1 out of 5 women will just be positive because the test is so sensitive and does not mean autoimmune disease. A lot of people with chronic health issues can be positive for ANA and does not mean autoimmune. Even, for example, in long COVID, that many of the blood tests are just negative or normal, and potentially that the testing that we have cannot pick up what is going on with people with long COVID, and we still need to learn. Or another example is mast cell, that the lab markers are so challenging to pick up that we're still not yet there yet for technology to um, measure it. Another aspect of testing is how we are measuring things in terms of research and studies, that how we measure things may not always be still the ideal way, that if we're testing things, it might be too short of a marker. If we look at a research study, only looking at things at 6 weeks as an outcome, is that really fair or long enough when people have this as an ongoing issue? Should be 6 months, 1 year as a benchmark. What happens when you study something for 6 weeks? What happens to that person? Should it really be studied longer? Or when you're studying something for a test outcome, if a person really says fatigue is their biggest issue, brain fog, is it really fair in a test to study somebody to really describe, um, for example, fainting as a test measure or just heart rate alone when really it is maybe other aspects of this syndrome? So testing can be challenging to know what you're measuring and what does it mean and the context and intent. This is very lofty, but I think when you do testing, always have measurement to self of what is it about? What are you measuring? What does it mean? What does the impact on you? And then always go back to, hey, I need to just take care of myself, my body and spirit. What are my core care aspects for myself? So some basic ideas about testing and test day.